You're listening to Medscape's In Discussion series on respiratory syncytial virus in adults, a podcast where thought leaders and clinical experts share their diverse insights and practical ideas for optimizing patient care. This series is hosted by Dr. Forrest Arnold. Dr. Arnold is the chief of the University of Louisville Division of Infectious Diseases and director of the Center of Excellence for Research in Infectious Diseases. He also acts as the co-editor-in-chief for the Journal of Respiratory Infections and program director for the Clinical Fellowship in Infectious Diseases. Relevant disclosures can be found with the episode show notes on medscape.com or the Medscape app. The topics and discussions are planned, produced, and reviewed independently of advertisers. This podcast is intended only for U.S. healthcare professionals.
Hello, my name is Dr. Forrest Arnold. Welcome to Season 2 of the Medscape In Discussion podcast series on RSV in adults. Today, we'll discuss RSV, respiratory syncytial virus in adults, and its impact on traveler health. First, let me introduce my guest, Dr. Chen, Associate Professor of Medicine at Harvard Medical School, the Director of Travel Medicine at Mount Auburn Hospital, and the past President of the International Society of Travel Medicine. Welcome to the Medscape In Discussion podcast.
Hello, everyone. Thanks for having me.
Dr. Chen, I'm so excited to be able to interview you today. This is a unique topic, and I'm sure it's going to be interesting. First off, why is it important to understand the impact of RSV in adults, particularly in travelers?
That's a great question. I actually have not found studies specifically on RSV in travelers, but the risk may be similar to COVID. And during the SARS-CoV-2 pandemic, we saw how respiratory virus incidence rates declined, not just SARS-CoV-2, but influenza and RSV as well. And there are many factors, including the use of non-pharmacologic interventions like wearing masks, avoiding crowded indoors, the advice on good hand washing, and reduced travel and reduced movement of people are all contributors. So I think it would be important to understand how often RSV occurs in travelers as well as generally in adults.
Right. It's important because as a respiratory virus, we know it can be transmitted, and traveling, even if you're going to be by yourself in a vast plane, it includes crowding to get there. And so we'll talk more about that, the traveling specifically later, but certainly important, and I think it's going to be great to address it. What are those common respiratory infections that travelers can be exposed to?
So over the years, we've seen respiratory pathogens like influenza virus, coronavirus, the common cold viruses. Many travelers have commented about how when they return home from trips, they've had cold symptoms, upper respiratory illness symptoms, and sometimes lower respiratory. TB certainly is another pathogen that we are concerned about in terms of travel-related exposures. And although RSV belongs to a different genus, so it's a completely different virus from influenza and coronavirus and adenovirus, the respiratory route does bring up similar concerns.
There's probably no certain geography except for wherever it's winter that RSV can be a problem. Whereas there's other respiratory pathogens like coccidioidomycosis, we kind of say, okay, the Southwest and Central America, it's a bigger problem, maybe hantavirus in specific areas out west. But RSV is so predominant that it seems like it should be really paid attention to, or at least discussed and entertained by anybody who's traveling. What exactly is the burden of disease?
So again, there hasn't been studies on respiratory syncytial virus in travelers or travel-related RSV, but it is among the leading causes of hospitalization for acute respiratory distress in infants and young children, and we've known that for a long time. What's less known is that it's also a significant threat to adults, especially those who are older. 60 has been the age that's been assessed more, or 60 and older has been assessed more. So the RSV attributable death is significantly higher in older adults than in infants. And in the U.S., there are reportedly 6,000 to 10,000 annual deaths that are attributable to RSV among adults who are 65 years and older. And along with that, it's estimated that there are about 60,000 to 160,000 hospitalizations attributed to RSV annually in that age group. Among the adults, it's the older adults that we're most concerned about. And then severe RSV sometimes is unpredictable, and adults 65 and older and those with chronic conditions or immune suppression are at high risk for developing severe RSV. And these are also trends that we see with influenza, with the coronavirus, with SARS-CoV-2, of course. And so these risk factors include chronic obstructive pulmonary disease, asthma, cardiovascular diseases such as congestive heart failure, coronary artery disease, moderate or severe immune compromise. And so many people are taking immunosuppressive agents or immune modulators nowadays, in addition to the people who are immunocompromised due to cancers or organ transplants. So it's a large population that is at risk.
Would you be able to speak to or at least estimate the economic impact?
There hasn't been good studies on RSV's economic impact in terms of travel-related disease, but the Journal of Infectious Diseases recently published a study that was a cost of illness modeling on U.S. adults aged 60 years and older, and that model estimated 4 million annual RSV cases in this age group of 60 plus, and also an annual economic burden of $6.6 billion, which is quite impressive. And about 4% of RSV cases are hospitalized, and that contributes to 94% of direct medical costs. And then among adults that are a little bit younger, age 50 to 59 years, the estimated annual hospitalization cost from that modeling study was about $422 million. So these are not trivial. And I think in terms of thinking about travel, if a traveler is ill, then they need to seek medical evaluation. Their trip may be interrupted. Their families that are accompanying them might also have to change plans. If they're hospitalized, there's that cost. And then if it's someone that's traveling for work and becomes sick with RSV, or for that matter, any illness, there's the loss of productivity for that individual and for the employer. So the economic impact for travelers who fall ill is significant, despite the fact that there are no specific data on RSV as a travel-related cost.
Right. We extrapolate a lot from COVID-19 and influenza, and we're all familiar with the shutdowns that occurred with COVID-19. Could any of that be extrapolated to RSV so that you could speak to that?
With COVID, it's a somewhat different situation because of the pandemic and the travel bans. So those caused huge economic impact on local economy, on the destinations economy, especially those that attract tourists or business meetings, and certainly airlines, entertainment, and the hospitality sector was definitely severely impacted. So if there were to be a significant outbreak of RSV among travelers, that a similar situation might occur. Although I think, again, the pandemic is a somewhat different situation with all the travel bans.
Let me offer a summary so far. We've reviewed RSV in adults in travel, and obviously, we have surmised that crowding is part of travel and that can be a factor when traveling. Older adults are more subject to getting respiratory viruses, including RSV. The model shows that over $6 billion can be spent in patients over 60, and in adults in their 50s, it's $422 million, both very large numbers with a high impact. So let's move on now. At what point in a person's travel are they at greatest risk?
Based on the experience with COVID, probably the crowded gatherings and indoors activities may present higher risk of exposure. And even though there were some airline associated or flight associated cases, it's the cruise ships illustrated the crowded indoors were in confined spaces. Those were great illustrations of significant risk of exposure for respiratory virus such as coronavirus, and that could be also applied or extrapolated for RSV. And then large meetings, large indoor conferences, for example, were also potential sites of exposure. And you might remember the CDC conference around April of 2022, where I recall that about 13% of people surveyed indicated that they had a positive test. So it's quite impressive. And then early on during the SARS-CoV-2 pandemic, there were some smaller business meetings that also reported the consequence of the business colleagues becoming infected. So it's these indoors, more crowded gatherings that are of concern. And something I didn't mention before was that if we think about the respiratory viruses, that if a traveler were ill or becomes exposed to a respiratory virus and then goes on to another destination, they are carrying it with them because travel is a loop. They may transit through airports. They may transit through a couple of stops en route to the final destination. So with respiratory pathogens, I think it's especially a concern in terms of exposures and potential spread elsewhere.
Now, you mentioned the CDC conference and that there were a number of attendees who were positive or had been positive, and I assume you were talking about COVID-19, correct?
Yes, exactly.
Yeah, that's impressive. It sounds like to me, when I look at what's going on today, that industries have been able to bounce back and manage because COVID hasn't gone away. RSV seems like it's worse, and yet we're still able to have large conferences and go on cruise ships and not get sick, but it is certainly a risk, and we need to do what we can to stay away from that. So what measures have been in place previously with respiratory infections that might apply to RSV in the near future?
That's a great question. And in thinking about it, I would think about the response to respiratory infection outbreaks and pandemics. And there were travel warnings and alerts from public health authorities. And then sometimes there were recommendations against travel. Sometimes it's to specific destinations. Sometimes it's much broader. So testing and vaccine requirements may be issued. And we saw that with the COVID pandemic, where people needed to have a negative test in order to participate in some activities, and sometimes even to move about and to attend certain gatherings, go to restaurants, go to a play, or get on an airplane or on a cruise ship to travel. And then COVID vaccine requirements came into place for some of those activities, sometimes in combination with testing. And also during the 2009 pandemic of influenza A, H1N1, vaccine requirements were issued in some situations. Probably the best known at that time was the Hajj pilgrimage. So this is where millions of people participate in the pilgrimage in Saudi Arabia. And there was actually an H1N1 influenza vaccine requirement in order to participate during that time.
Tell us about targeted genetic sequencing, known as TGS, and travel.
So the traveler-based genomic surveillance was developed by the CDC's Travelers Health branch, and they aimed for early detection of new SARS-CoV-2 variants and other pathogens and trying to fill in gaps in global surveillance for the infection. And there are actually three parts. One is where international travelers volunteer to self-collect nasal swabs. And then these samples are shipped to lab for SARS-CoV-2 PCR testing, and positive samples then undergo whole genome sequencing to determine the variant. And some samples undergo further viral characterization to look at their transmissibility, the virulence, the response to treatments or vaccines. So that's one part. A second part of that was the airplane wastewater sampling. And so wastewater is collected from certain flights, and those samples are shipped, tested by PCR. Positive samples undergo the whole genome sequencing also. And from CDC's information, it looks like that started around August of 2022. And then a third part is airport triturator drain sampling. The triturator is a consolidation point that captures the wastewater samples from multiple flights, and it doesn't include airport terminal waste. So it is the arriving or incoming flights from various destinations. And then these wastewater samples are collected and then tested. And that apparently started around April of 2023. And recently I saw an announcement that CDC expanded this traveler's genomic surveillance to 7 airports. And that includes surveillance for SARS-CoV-2, influenza, respiratory syncytial virus, and some other respiratory pathogens. I think it's a very interesting program because respiratory infections are relatively common among travelers. And I didn't mention earlier that GeoSentinel is a network of about 70 travel and tropical medicine clinics around the world that collaborate to track travel-related diseases. So in their analyses, respiratory illness is number 4 among various travel-acquired illnesses. And there's been a number of survey-based studies that looked at what travelers experience. And there was a nice review published in the Journal of Travel Medicine in 2017 that illustrated, again, the respiratory infections are so common. And so I think given the COVID experience, this tracking or surveillance for other respiratory pathogens would be really helpful in the future for detecting new pathogens.
Yes. So the genetic sequencing is relatively quick, but it's not so rapid that it's going to affect the traveler whom they swab. It's really just to do surveying and see perhaps what pathogens are coming from what regions of the world.
Exactly.
So tell us, before we finish, what is the role of RSV vaccination in travelers?
So now that the RSV vaccines are FDA licensed, we can certainly consider RSV vaccination for the high-risk travelers. The 2 vaccines are licensed for 60 years old and older. And I think based on the published literature, the people who are older certainly have the increased risk for severe disease, for developing lower respiratory tract infections, pneumonias requiring more intensive medical use and medical care. So I would think in that spectrum, probably people who are 75 and older should really think about just getting it. And 60 and up, certainly think about their comorbidities. And if they have illnesses such as asthma, emphysema, diabetes, immune suppression, cardiovascular, cardiorespiratory compromise, I think they definitely should consider vaccination seriously.
And one question about airplanes before we move on, and that is, have you seen reports that they're not as actually high risk to catch other diseases as we might think?
For some of the studies on respiratory pathogens, TB and influenza are probably the 2 that were well studied until COVID came along. And it was often cited that 2 rows from the index case is higher risk, and then further away would be lower risk. And I think with COVID-19, a number of people have commented on that with the modern aircraft with a high filtration rate of airflow, the HEPA filters in place that are in the modern aircrafts, the air circulation and filtration should remove much of the respiratory pathogen. So while the engine is on and these filtration systems are on, that may be more reassuring that the pathogens are removed. But if the engine is stopped, if people are boarding, deboarding, and also in the crowded airports, those are places where I would still have great concern about some of the respiratory pathogens being transmitted. And so those are situations I would still recommend and still feel more comfortable wearing masks.
Certainly. Today, we've talked with Dr. Lynn Chen about RSV in adults and travel medicine. And as we might imagine, acquiring respiratory virus is certainly easier in crowded areas. and airports and airlines are performing targeted genetic sequencing to use as surveillance. Thank you for tuning in. Please take a moment to download the Medscape app to listen and subscribe to this podcast series on RSV in adults. This is Dr. Forrest Arnold for the Medscape In Discussion podcast.
Thanks for listening to Medscape's In Discussion Respiratory Syncytial Virus in Adults podcast series with our host, Dr. Forrest Arnold. Be sure to look for more In Discussion episodes wherever you get your podcasts. Check out Medscape.com or the Medscape app for show notes, links, and more information on respiratory syncytial virus in adults.